Wash my hands. Okay. Hello, my name is Jeff. I'm going to be your nurse for tonight. I'm going to be doing an assessment on you. Is that okay?
Okay.
Okay, so the first thing I'm going to do is I'm going to assess my patient's mental status. I'm going to ask a series of questions and to see how she is neurologically. The first question is, do you know where you are?
Yeah, I'm in the hospital.
Do you know what time it is?
3:30.
Do you know why you're here?
For the assessment.
And then do you know who the president is?
Obama.
So my patient is alert and oriented ×3. Next thing I'm going to do is I'm going to assess my patient's posture here. And I see that she's sitting upright. She is actively listening. She is making eye contact with me. Moving on, I'm going to look at my patient's grooming. Like I said, she has her hair tied back. She has her jewelry on. She is, I see that her personal hygiene is good. I don't see any sort of stains on her shirt. Look like she's well maintained. Next, I'm going to, and then I see that she's coordinating with care and she is friendly. I see that I'm going to tell her three words and the three colors or the three words are orange, blue, and Jesus. Can you repeat that back to me?
Orange, blue, and Jesus.
Okay, so I'm going to ask her to draw a clock resembling 12:30 to see how she is cognitively. Okay. And as you can see, she was able to tell me a clock resembling 12:30. Okay, now, let me put this away. Do you remember the three words that I told you before?
Orange, blue, and Jesus.
Okay. And so I am going to, after this, I'm going to assess her speech. And as she was speaking back to me, I was assessing her speech and her language. And her speech is clear, very articulate. She has good voice quality. It wasn't too loud, it wasn't too soft. Her speech, I did not hear any sort of hoarseness. I did not hear any sort of slurred speech, or any sort of word salad or flight of ideas. Next thing is I'm going to observe my patient's mood and emotional stability. Like I said, her mood and her behavior is appropriate to the situation. I don't see any sort of anxiety symptoms. I don't see any sort of anger or hostility or any sort of irritability behaviors. The next thing is I am going to ask my patient 2 questions. Have you felt depressed in the last 2 weeks?
No.
Okay, and have you felt any sort of disinterest in the hobbies you were interested in before?
No.
Okay, so my patient is not exhibiting any sort of depressive symptoms in the last 2 weeks. Next, I'm going to perform a visual peripheral test. So, looking at my nose, I want you to tell me when you see the wiggling fingers.
Yeah, I can see.
Okay.
I can see. I can see. I can see.
Okay, so my patient was able to see my wiggling fingers from her periphery, so her peripheral view is intact. The next thing I'm going to do is I'm going to use my ophthalmoscope here, and I'm going to do a corneal light reflex. Basically, I'm going to be standing at a 15-degree angle, and I'm going to be shining my light, and with this, I'm going to be looking for a red or an orange light reflecting off from your pupil, and from there, I'm going to zoom on in, and I'm going to take a look at her eye characteristics and take a look at all the optic nerve and the blood vessels behind it. So let me turn this on here. Okay. hold my patient's head. And here. Okay. Come on this side. Hold my patient's head. Okay. And I see that she has a normal circular fundus. Her eyebrow or superior and inferior blood vessels are intact, and her optic disc is well defined and sharp. Moving down is I'm going to use a pen light here, and with this pen light, what I'm going to do is I'm going to use take a look at the light and take a look at her pupils and take a look at her pupillary reaction with the light directly and indirectly. So if you want to take a stare ahead, this side here. Look at her eyes here. Okay. I see her sclera is white. Conjunctiva is pink. I didn't see any sort of foreign bodies. Her pupils are 3 millimeters and brisk with the light. And also when I flashed the pen light, her pupils were equal, round, and reactive to light accommodation. Moving down, I'm going to take a look at her nose. And with her nose, I'm looking at her nose and I see that her nose is midline. Her nose is midline. I don't see any sort of deviation. Her ala is well maintained. Are you able to look up for me? I'm looking at her nose, inside her nostrils here, and I see her mucosa is pink. And mucosa is pink and it's wet and intact. I didn't see any sort of bleeding. I didn't see any sort of drainage. And then what I'm going to do now is I'm going to stand in front of her. And I'm going to stand in front of her, take a look at her lips. I see that her lips are, I don't see any sort of cyanosis. I don't see any sort of masses or lesions or any sort of cracks. Next, I'm going to ask her to open her mouth for me. Looking at her mouth, can you say ah? Ah. Okay, so the uvula is midline. Her soft and hard palate, I'm looking at that. her interior mouth lining is pink, warm, and I don't see any sort of caps, bridges. Teeth are aligned, white. I don't see any sort of bleeding, open areas, any sort of cyanosis or discoloration. Next, I'm gonna ask her to stick out her tongue. I'm looking at her tongue. It is midline. I see clean edges. I don't see any sort of deviation or any sort of cracks or any sort of ridges. Moving down is I'm gonna take a look at her neck. And I'm taking a look at her neck. Can you look up for a little bit? I see her trachea is midline. I don't see any deviations. I also don't see any sort of masses or lesions on her neck. And after that, I'm going to go ahead and palpate her neck. What I'm doing when I'm palpating is I have different landmarks along her face and her neck. And when I'm palpating, I'm going to use the 3 finger pads that I'll use 3 finger pads to assess her landmarks. Okay, so the first thing is her preocular, which is in front of the ear. Let me know when you have any pain at all, okay? Okay. Preocular and posterior articular, which is behind the ear. Submandibular, which is the jawline. Submandible, which is underneath the chin. Superficial cervical, which is outside the trachea. So I'm going to look at the trachea and then any sort of pain? No. Okay. And deep cervical. So I'm going to ask her to go and look on that way. And I'm going to look for the sternocleidomastoid muscle along her neck and palpate that. Okay. And the other way. Take a look at the same way, sternocleidomastoid. And palpate here. Okay. Alright. And then I'm going to take a look at her supraclavicle above her clavicle bone, and her occipital, which is behind the neck. Any pain?
No.
So my patients are reporting no pain, no tenderness, and they are very soft. Moving on, I'm going to take a look at her trachea again. I'm going to palpate for the trachea. I see its midline. I don't feel any masses or lesions. The next thing is I'm going to palpate her thyroid. So I'm going to look for the neck cartilage, and then I'm going to palpate on the outside. Do you have any pain?
No.
Okay, I don't feel any masses or lesions here. My patient is reporting no pain, and I didn't feel any sort of tenderness as well. This concludes my video. Thank you for watching.